Okay.
My name is Onome Osokpo. I am the liaison for the American Association of the Colleges of Nursing Graduate Nursing Student Academy for Stony Brook University. I am in the post-baccalaureate DNP program, and Stony Brook University is excited to participate in this very innovative and insightful project by the Graduate Nursing Student Academy, Great Minds in Nursing. We want to explore and tap into the richness of the ideas of individuals who have made a significant impact in the nursing profession and continues to inspire the next generation of nurse leaders. And it's my pleasure today to introduce to you Dr. Shurpin. What is the title?
Well, I have a PhD in nursing, and I'm an adult nurse practitioner as well as a psych mental health nurse practitioner. And currently I serve as the director of the Doctorate of Nursing Practice program here at Stony Brook. And I am academically a professor.
Thank you. Can you please describe your nursing work and the impact you've made career-wise in the profession?
Well, I can really describe it in two ways. The first is the actual clinical patient outcomes. I feel that whether I was in a role of leadership within a medical center or in an advanced practice role, such as a clinical specialist and nurse practitioner, I've served in both, as well as a professor, I have always impacted patient outcomes. I always think about the fact that at the end of every nurse that I am responsible to support or nursing student that I'm educating, there will be a patient who will be impacted by what I impart. And I take that very seriously because patients, patient care, and patient outcomes has always been my focus.
Thank you. Can you tell us a little bit more about the progression of your career, especially in the context of the impact you've made in nursing science, nursing education, nursing research in Stony Brook School of Nursing from the inception of this great institution?
It is a great institution, and I was lucky enough to be involved in it both in the medical center itself, opening that medical center, and then in a joint appointment with the School of Nursing, where I served in a leadership role in the medical center, a clinical leadership role, and then as a professor, as chair of a Department of Adult Health, which impacted both the undergraduate, master's programs, and then ultimately, I think one of the most exciting experiences has been this brand new doctorate, which was really developed in response to the patient needs, healthcare needs in the United States. So I'm very excited at this point to be involved in that level. I've always taught, whether I was practicing, because I think nurses are teachers, nurse-teacher. You're always teaching patients, patient families. You're always teaching other nurses, other health professionals, support staff. So I've always felt that, you know, the teaching aspect, being a really top educator is important. In education, I've been very concerned with grants to either put innovative interprofessional or problem-based learning into practice, new ways to approach education. Also, traineeships to support our nursing students so that they can have some of the financial balance in their life and are not so concerned with finances that they can concentrate on the importance of their education. In addition to that, when I think about my contributions to science, it's been in the area primarily of two areas: geriatrics. I was very involved in an interprofessional program called the Geriatric Education Center here in the medical center. We had that program for about 8 years. It was an attempt to infuse geriatric knowledge and support to primary care and acute care providers in all professions: medicine, dentistry, nursing, social work, pharmacy. Very exciting because, as you know, the aging society has needs that need to be addressed by us. And then in the area of oncology, my heart has always been in oncology. I have served for many years in the Oncology Nursing Society. I was an early leader in their education division. I was actually the chair of their education committee a number of years ago. The American Cancer Society, I've been a reviewer for scholarships for nurses pursuing advanced education with a focus on the care of oncology patients and families. And most recently, unifying my practice here in the Cancer Center, where I work with a nurse practitioner graduate of ours and a doctorate of nursing practice graduate, April Plank, and we work together in a lung cancer support group and in developing some innovative outcome science in the area of lung cancer, particularly evaluation, and also a concept called distress. So we've put into place the distress thermometer. We also have put in place some very innovative evaluation unit outreach programs. And I was actually happy to hear just the other day that Medicare has approved lung cancer evaluation for high-risk patients, which has been a long desire of those of us that work with people suffering from that disease.
I can tell this is a very exciting moment in the history of nursing. And from the things you have shared, can you talk some more how some of the leadership roles you've embraced, the impact you've made, how does that address issues of significance, not only in the older population, but in nursing education?
In nursing education, well, I think one of the exciting areas that I was able to contribute to was curriculum development for nurse practitioners in adult health, and moving that curriculum very early on here at Stony Brook to an online format so that nurses who were engaged in work and other aspects of their life could study at any time of day and could continue their education to improve patient outcomes. I must say Stony Brook was one of the early adopters of online education, which of course has become very prominent in later years in many settings. The other area, I think, has really been the development of and the ongoing evaluation of the doctorate in nursing practice program. I have great hopes for the outcomes that that particular program will improve in terms of patient and population health. Recently, just Sunday, we met with some of our early graduates of our first class, and to hear what they are doing 5 years later really speaks to the essentials of the DNP, the practice doctorate. For example, one of the students has published a number of clinical articles, but is also one of the founding individuals on the oncology nursing website, Evidence-Based Practice, area, where she is one of the reviewers of evidence for practice in oncology nursing. Another member is one of probably the most nationally known experts in immunizations, and is one of the only nurse practitioners to serve in some of her high-level positions, such as CDC. When I heard the students talk about what they have been able to accomplish post-graduation, it was all outcomes, effectiveness, and evidence-based practice focus, and that's exactly what we are hoping to really, really impact in terms of educating other nurses, as well as promoting better health for Americans. Also, many of them were in primary care, where there's such a tremendous need, and really working with vulnerable populations. So again, to actually hear their stories has been very, very informative and very helpful in terms of further improving the program here at Stony Brook to even focus more on some of the areas that they've really found success in.
Looking at your leadership in nursing and in healthcare in general, how will you, I know you've talked a lot so far about what you've been able to accomplish. How will you describe the significance and the impact of your leadership? How will you, looking at those coming behind the upcoming nurse leaders, how will you, communicate how you've been able to impact the nursing landscape, both in the educational setting and in the community?
Well, I think the first word I would use is passion. You have to have a passion for both the profession and for those we serve. And when you lead, you need to focus that passion on those you're serving versus you yourself and your own needs. You really need to see where the needs are in leadership, and you need to be very collaborative. You need to be very almost democratic in your approach. My style of leadership is to empower others, and one of the outcomes that I often measure to see how effective my leadership style is the success of graduates and nurses that I have been in a leadership role to support. There are graduates who are at extremely high-level positions in major healthcare systems. There are graduates that are doing investigator-initiated research. There are graduates who are doing far more than I could have ever imagined. So I would say empowering those to take on their passion and move forward in a very positive way. I don't see leadership ever as coming down onto people. I don't see the pyramid. I really see a circle. And I really think that I'm one of the spokes in that circle, and that so are any students or anyone I am in a supervisory role with, and that we all sort of come together in a format which is very egalitarian and very supportive. So does that answer your question?
Yes, it does. And a follow-up question will be, what will be better in nursing science, because of your leadership? What will be better in the healthcare landscape because of what you have done, the impact you've made, the significance of that impact? In your own words, what do you think will be better because of the entire investment you make to make the lives of patients better by creating this group of people who are passionate and impacting the healthcare landscape?
I would actually have to say that one of the areas will definitely be ongoing outcomes effectiveness research that influences patient populations in actual clinical settings. And also the ability to really evaluate the evidence in terms of the state of the science in any specialty area or any area of need in healthcare. If there's two areas I've become very excited about, it is both the development of integrated reviews by students where they're actually able to evaluate the science and come up with plans for better interventions and better approaches to manage populations now. Not just one patient after another very well, but to look at that population as a whole and impact the whole population. So I've watched nurse practitioners move from being terrific caregivers and taking excellent care of each patient they see, from now talking about seeing the global picture and seeing the issues of that population, and not just taking good care of each patient, but now really moving to serve the population as a whole. So don't just impact patients with heart failure that I care for every day, but then be active in the Heart Failure Society and be active in the American Heart Association and do research in that area to affect the population as a whole. That's very exciting to me. And I'm really beginning to see this happen in clinical practice. For a long time, my bias is that we would study research, we would do very interesting studies, and they would certainly contribute to the science of nursing and to science in general. But the real world outcomes were not being as influenced as quickly as I felt they needed to be. But that's part of my issue. I like translational research and really looking at moving good science quickly into clinical practice and improving outcomes. I can't say that enough. When I see some of this research, it's profound.
So how does your science and leadership relate to local, state, and national policies?
Okay, well, in a few areas. One has been both in nurse practitioner practice, and the other has certainly been in the area of oncology nursing or Medicare reimbursement. I think today we cannot ignore some of the reimbursement issues as they relate to policies and as they relate to funding to improve health care. So for example, before I gave the example of Medicare now funding lung cancer evaluation for high-risk patients, this policy came as a result of working with Lung Cancer Alliance, lung cancer associations, nursing associations in oncology, and multidisciplinary teams, and providing data to support the outcome of early diagnosis of lung cancer and improved outcomes for that disease, which at this point had very poor statistics because patients were diagnosed so late. So being involved, you have to be a member of your local as well as your regional as well as your national organizations. I also think that AACN and working through AACN, I do volunteer as an evaluator of programs, and I think again it's another opportunity to contribute to policy, to improving education and standards. And I think that our standards now in nursing education has really fostered some of the movement in independent practice for nurse practitioners and midwives, and some of the other issues that will really help provide more healthcare providers in areas that are very underserved in this country. We have a great inequality of service.
I want you to talk some more about that. So I will ask this question. How do you expect to inform or translate your research into healthcare policy?
Okay, well, you inform and change it into healthcare policy through dissemination. And dissemination can be in multiple formats and needs to be at within multiple organizations. It's no longer possible to just discuss and disseminate your research to those in your field or those in nursing. You need to include stakeholders. You need to be able to talk to your politicians and advocate for the science that you are involved in and translate it into terms that everyone can understand. One of the courses we have here at Stony Brook, not from the School of Nursing, but from the university, is called Communicating Science. And communicating science is about communicating science to everybody, not using science speak or nurse speak, but rather communicating in a way that's understandable by all. And I try to teach the students and try to do myself the elevator speech. So for example, I'll give an example of a study I worked on with a student. A student found that the transition of care in her population of diabetic patients from pediatrics to adult care was problematic, that the outcomes were very poor, that the blood sugars were getting out of control of these patients during that time period. They were missing appointments. She did her research. She came up with a program for a transitional clinic for emerging adults. She put that into practice. She has negotiated multiple systems to do so. She is now disseminating that both at conferences. She is disseminating that in journals. And she is disseminating that through patient-family organizations so that stakeholders can also argue for this type of available resource in other settings. When she presented it here at Stony Brook, people said it was not just applicable to diabetes, that young people with other chronic diseases such as cystic fibrosis have the same issue when they transition from pediatric to adult care. And you can imagine what a change that is. There's a very different framework generally in a pediatric versus an adult practice setting. So you need to be very inclusive, and that's how you change policy. I always say talk is not enough. You have to demonstrate the difference that an outcome can make. So if you have an intervention and you think it needs to be funded, you need to demonstrate that. We have a lot of work in this area. We're very lucky. I'm active in the American Academy of Nurse Practitioners, and they have a Washington area that they influence for policy. We have the New York State Nurse Practitioner Organization that really impacts policy at our level. We have health policy courses in all of our programs. Currently in the doctoral program, 2 of the people in the program are actually major officers in the state who have impacted our even most recent Nurse Modernization Act and share that. So again, becoming very good at disseminating and using language that is understandable by all.
Thank you very much. I know you've alluded to this, but we really want to tap into the richness of your mind. How does your science impact healthcare systems, looking at healthcare systems?
Well, system evidence to support system change is as important as evidence to support patient outcomes directly. because if a system is not functioning well, then the best providers in the world will have multiple barriers to impacting the outcomes for those patients. So the areas that I'm interested in there is very much the quality improvement area, the whole issue of errors and preventing errors, systems analysis, and coming up with theories that help promote system change. And in doing so, I, along with other faculty, have developed a systems course specifically for our DMP students. They do microsystem analysis of the very systems that they work in, which is very important because we think about systems at the macro level, but microanalysis is critical. And we teach the skills in how to do systems analysis and then identify strategies for change and thus improve the system to ultimately improve the outcomes. And how do you get buy-in? How do you get buy-in from people? So the example I gave before of the transitional care clinic is a really good systems change project, as well as one that has impact on patient outcomes. Yes, it improved hemoglobin A1Cs and it improved cancellations. People were then making their appointments. But a whole system had to be adjusted and analyzed to see what could be done. So healthcare systems, a little bit more challenging to change depending on the environment, but assessing those systems and finding ways to work within them are essential. Again, always being inclusive, getting everyone involved. Don't identify a system issue alone. So I encourage DMP students to ask everyone that they work with, what do you think we could improve in our current healthcare delivery system here? And unless you get everyone's consensus and consensus building, you'll never promote system change. Same is true in academia. We're a system too. And then how do you impact other systems? But unless you get consensus and unless you get everyone involved, my very best idea may have nothing to do with what you would value and see as a systems change issue. So it would never be effective no matter how excited I was about it. You have to be excited about it too.
Is there other information you would like to provide regarding your program of research and scholarship?
Other information. Well, I think that as many people who are faculty and nurse practitioners, our programs are more multifactorial, because you may be interested in a clinical area, you may be interested in healthcare policy, you may be interested in education and education research, and you may be interested in all sorts of other interests. You might have an interest like I have with distress and cancer. And so for many of us, we have programs that touch on many different areas, yet they do come together in some way, in that they're either very outcomes-based oriented, which is the science that I have interest in, or it is very investigator-initiated, which would be Dr. Juergens here on faculty, whose study of heart failure and symptom appraisal is her program of research. So I, like many people of my era in education, have combined educational research and improving educational outcomes along with some of our clinical interests. Does that answer your question?
Yes. And I think the most significant part of this interview is my last question. What advice do you have for the next generation of nursing leaders. And I really want you to pour your heart out so that people like me can see the path ahead, the road ahead, and know what to do to really create the same impact and make the same contribution or even more that you have made.
Well, my expectation is you'll all make even more than I have made. And what I would say to you is you are entering our profession at probably one of the most exciting times. And having been in this profession for 40 years, I can assure you it's one of the most challenging yet exciting times with great opportunities to be a leader. And the first thing I would tell you, and I tell every nurse, is I'm 100% on board with the concept of seamless education. That the older way, where many in my generation received one degree, had a certain number of years of clinical experience, received another degree, a certain number of years of clinical experience, then our final degree, which for me was a PhD. I really feel that we need to change that. And the IOM report, and many speak now of seamless education. That is, move through the education process seamlessly. Don't believe that you have to keep getting years experience before you get the next degree. You will be getting experience as you continue your education, and it's a beautiful blend. So I would encourage you, first of all, to go right through to either a practice doctorate or a research doctorate as smoothly as you can transition. I would also advise that leadership comes in many forms. There's what we think of as traditional leadership, which is, directors of services and CEOs of nursing and also deans of nursing. That's wonderful, but there are many other leadership roles. You can be a clinical leader. You can be a leader in a clinical organization. You can be a leader in policy. You can be a leader in a specialty. I mean, there's so many areas that you can lead in. I would also tell you not to think too narrowly and don't limit yourself too quickly. You don't know what leadership roles will present themselves. I don't think we know what some of these leadership roles will look like yet, even in our ever-changing healthcare. So don't limit yourself. Never think that that going up a traditional line of command is the only leadership opportunity. Think about other ways to lead, and think about other leadership opportunities. So you don't have to go from being, for example, a professor to a chair to an assistant dean, or a head nurse or nursing care coordinator to a director. It doesn't always have to be in that way. There are many different forms of leadership. And I think also think interprofessional. There's no healthcare delivery system or educational system that will not benefit from the cross-pollination of all the different professional perspectives. And don't even think just nursing, medicine, and the traditional ones. Think political science. Think communicating science. Think engineering. I think be a more global thinker and look for opportunities that are innovative and provide partnerships that were not perhaps thought of prior to an era like today. Become very savvy in understanding clinical data, understanding evidence and evaluating it. Become very, very expert in those areas. They will serve you well as a leader. Base all of your decisions on evidence and not just on what you think, what always was Forget about what always was. We really need to think differently, and we need to think more creatively and be creative. One of the issues I think in healthcare is we get very much into the science, into the practice, into the protocols, into the standards, and that's important. But creativity also has a role in leadership. Think out of the box, think differently, and you might find that the healthcare system that we need actually becomes a reality. I have great hope for nursing and for healthcare based on the uniqueness of today's nursing student. They're very different than the nursing student that I recall in my era. Most of us went straight from high school into nursing. Today we have many programs that are accelerated for those with degrees in other areas. They bring such a unique perspective, whether it be law, nutrition, engineering, music. They bring a new perspective, and they bring a broader perspective to our profession. And I think it's one of the types of programs that has helped move nursing forward and will probably produce many nursing leaders that have new ways of thinking and understanding the world. And that would be the way I would advise someone today.
Thank you very much, Dr. Shurpin, for taking the time out of your very busy schedule to share with us and give us insights into how to bring about positive patient outcomes, how to impact healthcare systems, and what we need to do specifically, those of us coming behind, to really create the kind of impact we've seen you and many nurse leaders do in this country and globally. So I want to thank you for taking the time to do this.
It was my pleasure, and best of luck in your leadership roles in the future.
Thank you very much.
Did we do okay?
Oh,